Hi everybody, my name is Ayman and I'm a PGY1 at Duke Surgery. Thanks for taking the time to listen to some of the work that we did when I was at Tulane Medicine under the mentorship of the trauma department there, including Dr. Sharven, Taghavi, and Dr. Juan, Duchesne. Our study asked the question, what is the most effective screening strategy for cerebrovascular injury in the blunt trauma patient? We were inspired by a recent study out of Alabama by Dr. Black, who kindly contributed data for our model and is a co-author. His group demonstrated that relying solely on traditional screening criteria, like the Denver, Expanded Denver, or Memphis, would have resulted in many missed cerebrovascular injuries, with the best one missing approximately 25%. Each of these missed injuries subsequently translates to a risk of thromboembolic events, with many potential quality of life years lost. That's what drives this model below: missed cerebrovascular injury having a higher rate of stroke. Below is an image of a probabilistic sensitivity analysis, in which we varied all inputs simultaneously based on the original variance and distribution of the data. Ultimately, we found that with a willingness to pay threshold of $100,000 per quality adjusted life year, the optimal strategy was universal screening, although the expanded Denver was quite close. In fact, what we found in one-way analyses, where we took single variables and modified them to study the effect on the model, was that ultimately the most significant input was the prevalence of extracranial cerebrovascular injury in the population. Above 6%, Alabama, by the way, found about 8%, and traditionally the values quote at 1 to 2%, but above 6%, the universal screening strategy is dominant. Again, with lower prevalence, this changes and favors the expanded Denver. Furthermore, we found that part of our results depend on the effectiveness of treatment, which we assume to be primarily antiplatelet. In conclusion, what we found is that universal screening is a cost-effective approach in select populations, although our results would benefit from much more research, particularly longitudinal outcomes on patients with cerebrovascular injury. Thank you.